70. Well, so many kids and adults right now are using remote learning, and if they're not set up properly, it can lead to back or spine issues. We're joined now by Dr. Joanne Wu from Rochester Regional Health to explain what kids should be doing to avoid pain or injury. Dr. Wu, thanks so much for joining us this morning. I know that this is something that I have to think about in my ripe old age, but it's never too early to start wondering, when your kids' back health can be affected.
Yes, thank you for inviting me today. I appreciate this very important topic as well.
First I want to start off with some indications that maybe your child is experiencing back pain, and how young can that start?
That can start quite young. A lot of times behavioral issues start to arise when kids experience pain. They just don't know how to vocalize it. So it may become a little bit more irritable, a little bit more withdrawn, having some difficulty with sleep. Certainly it can affect their performance at school. So you'll see that their grades might slip. Those kinds of behaviors can indicate pain.
It's kind of like eyesight. You don't know if your kid has bad eyes until all of a sudden they're getting headaches, and that's an indicator that they may be squinting in class. I know that was the case for me anyways. What are some things that we can do at home to make sure that our kids are able to learn comfortably?
So one of the things that we highly recommend families to do is really have a dedicated workspace. And for some families, that might be easier than others, where they can set things up in an actual office or in the dining room. One of the things that we've been seeing amongst children is that there's a tendency to work on the couch or on the bed. That might not be the best place ergonomically, or a place that they can really truly focus on their work.
Yeah, I know if I sit on the couch and try and work, it always seems to pinch my sciatic nerve. Can you get that when you're that young? I feel like these are problems I've had in my 30s, but can you have back issues, and what kind of back issues can kids get and tell us the ages? I'm assuming early as elementary school age.
So some of the patients I've been seeing, mostly in their teens, I've been seeing where the growth spurt starts to happen. They're starting to experience just a generalized pain, achiness of the neck. You mentioned headaches.
Right.
And then the low back hurts, their hips hurt, just in general, just not feeling well. Those are the complaints that we've been seeing since virtual learning has started.
Are there long-term effects if it starts now when they're, say, at home the next few months and sitting on the couch and doing homework? Can this last into later years? Can it permanently affect their spine?
These are excellent questions, and certainly from a spinal integrity standpoint, we might see more folks have scoliosis or kyphosis, curvatures of their spine during these growth spurt periods because of their postural positions with virtual learning if it's not set up correctly. But in general, we're seeing more just musculoskeletal disorders affecting the muscles themselves, where kids are becoming more sedentary, they're not moving, sports are at an all-time low, so they're not able to really break away from these postures for too long.
So dedicated workspace for the kids at home if you can, moving around as often as you can. Dr. Wu, is there a certain chair, we have about 30 seconds left, that you recommend they sit on?
No, actually, I just recommend not sitting on the floor.
Okay.
And again, not sitting on the couch and sitting on the bed. Those are key things. I actually recommend investing in stand-up desks that you can place on dining room tables, just like adults. It can be very helpful, particularly for the teens, so that they're not sitting all the time.
Yeah.
Again, taking a lap around the house, days like this, beautiful, right? Close to 70s, as you mentioned. Go for a walk.
Excellent advice. Thank you, Dr. Wu. We appreciate it. We'll be right back.